I'm Lucy Beach from Lucy Beach Training and Consultancy Limited, and I'm hoping to be part of Linda Schwer's top team of Care Bill trainers across the country. For the last 21 years I've worked in health and social care commissioning, and I have a wealth of skills, knowledge and experience in the sector, and today I'm going to focus on the implications for commissioning of the Care Bill. The Care Bill is a modern piece of law for adult care and support in England, and it replaces and updates complex and outdated legislation. It introduces a care and support system that is clearer, fairer and fit for the future. It focuses on people's well-being, supporting them to live independently for as long as possible. The bill introduces some general responsibilities for all local authorities to all people within their population. Now that's a big change from previously, when it was they were really only responsible for those people who met the eligibility criteria that they set. So there's a big change there in terms of a wider scope of people to support. The bill introduces a concept of well-being, and this underpins the whole legislation. Although, having said that, it's not entirely clear what well-being really means in practice. There are a number of universal obligations that the bill introduces, and that covers things like prevention, advice and information, and promoting diversity and quality within the market. It also introduces a requirement to collaborate and cooperate with other public bodies and to promote integration with the NHS. And I'm going to focus on some of these things from a commissioning point of view. So I'll start with the commissioning cycle. One of my key frustrations is that commissioning is a word that's widely used, but I think actually in reality is little understood. It's often confused with contracting or procurement, but it's actually much more complex than that. Contracting and procurement form a part of commissioning, but it's actually a very complex arena. And I'm just going to draw you a quick diagram of the commissioning cycle, and I like to think of it in 4 stages. The first stage being analyse. And analyse covers a number of things. So, for example, being cognizant of any new legislation, being aware of the needs of your population, so the work of the Joint Strategic Needs Analysis, undertaking any benchmarking, looking at any new guidance that may come out from the Department of Health, and looking at your current provision, your current market in terms of provision of care and support for particular client groups. The next stage is plan, and this is key. In the planning stage within the commissioning cycle, it's all about looking at gap analysis, looking at redesign, modernisation, transformation, developing business cases for new models, looking at options appraisal, working with customers and carers in terms of designing services to meet their needs. So this is, for me, this is a key part, and is actually a very complicated part of the process. So we go from analysis to plan, and from plan we go to do. And for me, this is a critical thing that is often overlooked. A lot of work may go into the analysis and the planning, but there's very little sometimes of the actual do, and it's really the implementation of your planning. And this is when you would work with colleagues within procurement and within contracting to develop your service specifications and look at your models for procurement in terms of the services that you wish to commission for your area. You may need to do some soft market testing, develop some capacity in the market if you're looking at delivering new service models that don't currently exist. And then from do, you move round to review. So once you've implemented your plans, once you've done your plans, you really then need to evaluate, get some feedback from customers and carers and health and social care professionals to see whether or not that's working out in practice. And it really comes down to good contract management and good relationship management with your providers in terms of the care and support that's being provided. And then it goes back round to analysis. At the heart of everything that we do as commissioners is the person or the population for whom we want to support, and that could be commissioning on an individual basis if you're perhaps a social worker, or for the whole population if you're more of a strategic commissioner. And it's really important to engage with your stakeholders. So in terms of what a commissioner's role is, it's actually pivotal. As a commissioner, you're a real advocate and champion and local leader for your particular group or particular population, and you have a huge influence in terms of the way that services are delivered and in order to get good outcomes for people. So in terms of how commissioning needs to change as a result of the Care Bill, one of the key things is around market shaping, market development, market facilitation. With the introduction of personalisation, the local authority will no longer be the key commissioner or key purchaser. That will be transferring over to the individuals or through direct payments or direct payments to a suitable person. So that traditional purchasing role, that plan, buy, check model, that is really changing, and we need a different set of skills and a different mode of operating. So as I said earlier, there's a duty within the Care Bill to ensure that there is diversity of types of support within your local area. So for example, as a commissioner, you need to ensure that there are choices available for people. So for example, that there's a choice of supported living providers, a choice of day services, a choice of short breaks facilities, so that it's just not monopolised by one particular provider or indeed the in-house provision. I mentioned in this diagram the need to analyse the needs of the population, and that would be done through joint strategic needs assessment and in terms of developing strategies, health and wellbeing strategies or individual strategies for particular client groups. And that's for the whole population, including self-funders and those affected by DILNOT and the cap on care. So some key changes there for commissioners, that they really need to get a grip on understanding the needs of their population and the services that they have. And linked to that is really having a grip on understanding the supply and demand within the area, and it's really important that commissioners monitor the match between supply and demand to ensure that there is an adequate supply to meet need. And one way of doing that is through developing market position statements. Now, market position statements can be a really good vehicle for setting out an authority's direction of travel and giving good information to providers. So, for example, in high-level terms, it would set out the demographics, the projected changes in demand over the coming years. It would identify any gaps in the market. So, for example, there may not be enough supported living, or there may be a need to develop services for people with profound and multiple disabilities, or people with dementia or challenging behaviour. And it's a real opportunity to actually write that down if there are particular gaps in an authority's area. And equally, it'd be really important to write down whether they don't need any more provision. So, for example, if there's sufficient supported living or sufficient care homes within an area, then that would be important information that providers would need to help them inform their business planning. In terms of new duties that the bill introduces, there are some new things that commissioners will need to be aware of and to make plans for. The first area is around prevention, and this is a key thing within the Care Bill, around preventing the need for care and support, or reducing the need for care and support for both the individual adult and indeed the carer. So that is something that, from a commissioning point of view, you would really need to think about how you would go about doing that. Similarly, there's a duty to establish an information and advice service, and again, from a commissioning point of view, you'd really need to think about how you would go about doing that, whether that's an online service, an actual physical building in particular towns in the county or borough, whether it's a telephone service. So you really have to think how you'd scope that out, what it would offer, what accreditation or qualifications any such service would need to have. And the third area that is new is that local authorities need to make provision for advocacy, particularly for enabling individuals to fully participate in any assessment and planning process, or indeed to be fully involved in any safeguarding case. So if that's currently not commissioned, then that's another area that would need to be undertaken. So for all these areas, local authorities will need to consider what and how to commission the services, and it would be going through the 4 stages in the commissioning cycle that I outline here, being cognizant of any local services that already exist, any national schemes that exist, for instance on the advice and information. Does NHS Choices provide any basis as a start? Do places like the Citizens Advice Bureau provide anything that might be appropriate? A key challenge though for these new areas is obviously funding, when most funding would already be committed. So how would local authority commissioners rise to that challenge? Sorry, another key area for commissioners to consider is the Care Bill provides an opportunity to delegate out the social work functions, and this may be something that local authorities may want to consider. There have been some good examples of pilot projects around the country where organisations have set up like social enterprises, and that has really helped in terms of innovating creativity, plus also giving freedom to social workers to do things differently. So local authorities really need to consider if that's something they want to consider doing, if so how to do it, and thinking about some of the 2P implications for doing that. In terms of opportunities for providers, there are huge opportunities for providers with this new legislation. They will be able to respond to individual and carer needs through the personalisation agenda. They will be able to diversify their service offer and perhaps develop new business, i.e. in the prevention area perhaps. They'll be able to work with commissioners to identify and address gaps in the market, and that will be a first genuine opportunity to really have adult conversations with one another in terms of developing appropriate services in the local area. And I think one really exciting thing to consider for commissioners is whether there are different models, particularly around asset-based community development and time banking, and that's something that I've looked into, and I think that does create a really exciting opportunity. So just to sum up, from a commissioning and contracting perspective, local authorities will need to consider doing the following: commission prevention services, advice and information and advocacy services, and really respond to the changing role of commissioning and contracting to be more about market development and facilitation, and whether or not they want to outsource their social work function, which would be a huge decision but could yield real benefits. And lastly, I think local authorities will really need to review the skills, competencies, resources and training needs of their workforce to really fulfil the new obligations and to ensure that they're legally accurate and work within the new framework. So thanks for listening, and I hope that's been helpful.